Indian kids show diabetes signals early. At 18 years, 37% of men and 18% of women had elevated glucose level pre-diabetes. This was despite half the participants being underweight. A 3 decade study tracking more than 700 Pune families now going into the third generation has sought to understand why diabetes is so common in Indians and found a tendency towards high glucose in early childhood in many individuals. The authors have called for a diabetes prevention strategy from early life. This comes close on the heels of a recent recommendation by experts to lower the screening age for diabetes from 30 to 25 years. How were these families tracked? At the diabetes unit of KEM Hospital, Pune, scientists have been carrying out research for 35 years to understand why diabetes is so common in Indians. In 1993, they embarked on the Pune Maternal Nutrition Study (PMNS) across 6 villages near Pune and have followed more than 700 families since. They have tracked women from before they became pregnant and during their pregnancy and their childhood, puberty, and now as adults. The study poor in utero growth reduced by B cell compensation and high fasting glucose from childhood are harbingers of glucose intolerance in young Indians. By Dr. C.S. Yagnik, Director of Diabetes Unit at KEM Hospital and co-authors has been published in Diabetes Care, a journal of the American Diabetes Association. What are the findings? The researchers measured glucose and insulin concentrations and other vital data at ages 6, 12, and 18. At 18 years, 37% of men and 18% of women had elevated glucose level pre-diabetes. This was despite half the participants being underweight, body mass index less than 18.5 kg per square meter. Children with suboptimal growth in the womb carry high levels of risk factors for diabetes from early childhood, including high circulating glucose level. The tendency towards high glucose was visible when measured at ages 6 and 12. The researchers concluded that was driven by a poorly functioning pancreas which could not cope with the demands of increasing age, and that this very likely reflects poor growth of the pancreas during fetal life as part of general growth failure. One, maternal glucose is minimally increased during pregnancy, even the stresses the baby pancreas. How widespread is diabetes in India? According to World Health Organization, India has estimated 8.7% diabetic population in the age group of 20 to 70, with around 77 million with diabetes. A first National Nutrition Survey 2016-18 by the Union Ministry of Health and Family Welfare, UNICEF and Population Council among children and adolescents too found that diabetes is affecting children in a big way. Released in 2019, the survey said that almost 1 in 10 children ages 5 to 9 were pre-diabetic and 1% with already diabetic. The rising prevalence of diabetic is driven by combination of factors: rapid urbanization, sedentary lifestyle, unhealthy diet, tobacco use, and increasing life expectancy. What is the current strategy for screening? The current recommendation from the government to begin screening for diabetes is at 8:30. Diabetes prevention trials still mainly target middle-aged individuals who already have obesity and advanced metabolic abnormalities, Dr. Yagnik said. An ingredient life course approach is required and prevention has to start at the community level and not just in the clinic. What we need are public health experts, not just doctors, to tide over this problem. Dr. Yagnik said constructing such evidence is beyond the scope of clinicians and will take a long time. We need to act sooner than later, he said. Dr. Sasank Joshi, Chairman International Diabetic Federation Southeast Asian, said, "This is predominantly in the research domain. We do not have sufficient data to translate in the public health domain. Especially in a resource limited country like India, we need robust translational research that is reproducible, affordable, and has hard evidence from a public health standpoint." A new report published in the journal Diabetes and Metabolic Syndrome Clinical Research and Reviews 2 shows a trend of the increasingly prevalence of diabetes in younger age groups in the last decade. After analyzing data from various diabetes centers, research found that 77.6% of those below 30 were either overweight or obese. The report's lead author, Dr. Anup Misra, had said the government should lower the age of screening. Dr. Joshi said this is a countrywide study and several others have recommended screening above 25 years in a resource limited countries, including India. The focus also on women and childhood. Maternal nutrition during pregnancy should be focused upon as a preventive measure. Thank you.